Hello, my name is Colin, and for my project, I did claustrophobia, and this is understanding the fear of confined spaces. Uh, what is claustrophobia? It's an intense fear of small, enclosed, or crowded spaces, and claustrophobia falls under a specific phobia, an anxiety disorder. Um, Common triggers for this are elevators, airplanes, MRI machines, and crowded rooms. Claustrophobia is more than just a discomfort and can trigger panic attacks. Symptoms for claustrophobia, emotional symptoms are panic, fear of losing control or suffocating. Symptoms for physical include rapid heartbeat, shortness of breath, and sweating. Behavioral symptoms include avoidance and needing escape routes. Um, Causes and risk factors for claustrophobia are usually from traumatic events, which typically happen when people are younger, especially in their childhood, and can also come genetically, and people could have a family history of anxiety. Um, Brain function, overactive amygdala, which is in the diagram below, and high trait anxiety or nervous temperament. The daily life impact of claustrophobia usually is people like to avoid elevators, flights, or tunnels, and this limits job choices or social activities because of their phobia, and they have fear of embarrassment or panic in public, and this may lead to isolation or depression if untreated. Treatment and coping, cognitive behavioral therapy, which is a structured short term therapy which can help people recognize and change negative thoughts, patterns, and behaviors. Uh, Another therapy is the exposure therapy, which is a psychological treatment where a person is gradually and repeatedly exposed to the object or situation they fear in a safe and controlled way. This reduces anxiety over time. Medications, SSRIs, and anti anxiety drugs. SSRIs are medications primarily used to treat depression and anxiety disorders, including claustrophobia and many other phobias. And coping using breathing exercises and mindfulness. Support groups and online forums are also other ways. And claustrophobia is highly treatable with the right help. Um, these are just some statistics and for population, and about 10% of world experience to some degree, but the severity does vary. Women are more likely than men to have claustrophobia, and 12.5% experience some kind of specific phobia like claustrophobia in their lives. Um, Many individuals usually don't seek treatment, and only a small percentage receive the appropriate care. And in the graph below just shows the age groups and the percentages that go along with them. This is my peer review study. Um, Prevalence and fear focus basically just tells you what claustrophobia is, and the same thing with about 12%, 12.5% of the population, and it's higher prevalence in women. And the fear focus is not just being a space, but what might happen inside it, and suffocation, panic, and losing control. Common triggers, same thing: locked rooms, elevators, MRI machines, those kind of things. Um, Etiology, which is basically just the causes, which is can be neurobiology, which is disruption in the frontal brain circuit, similar to social anxiety disorder. Um, can be genetic, and fear response mechanisms, heightened fear response to stimuli, and they are inability to get used to the fear of stimulus. Symptoms, same thing: shortness of breath, sweating, chest pain, hyperventilation. Uh, Evaluation. This assesses daily impact in fear triggers. Treatment options, there's many. The cognitive behavioral theory, like I said earlier, the exposure theory, virtual reality theory, which stimulates environments like MRIs to reduce anxiety, and then medications like the SSRIs. Um, Complications and differential diagnosis. This is just they may coexist with PTSD or depression or just generalized anxiety. Um, they have risk of social withdrawal, functional impairment, in rare cases, suicidal thoughts. Um, Interprofessional care, uh, psychologists, psychiatrists, nurses, technicians. They provide coordinated support, especially during medical procedures. And the goal is to empower the patient, reduce anxiety, and improve long term outcomes. Um, Patient education, basically just educating people about symptoms, triggers, and treatment options. And then you want to encourage self help, and avoid known triggers when possible, and help patients identify early warning signs. And then, just for conclusion, claustrophobia is a real, common, and manageable phobia. Um, and then empathy and support always makes a difference. And those are my citations.